Good afternoon or good morning. So this will be our lecture for our lymphatic system. So these are the functions of our lymphatic system. First is fluid balance. As it was discussed back in your blood vessels, blood enters the capillaries, and not all the fluid that enters the capillaries exit back into the blood. A portion of the fluid that enters the tissues will be drained out by the lymphatic system. This fluid is called the lymph. It is an old term for a clear white fluid, and it passes through the lymphatic vessels to return to the blood. The second role of our lymphatic system is for lipid absorption. The lymphatic system absorbs lipids and substances from the digestive tract through lymphatic vessels. And third is defense. The lymphatic system is involved with fighting infections as well as filtering blood and lymph to remove pathogens. So this is the anatomy of our lymphatic system. So the components of our lymphatic system consist of our lymphocytes, lymphatic vessels, lymph nodes, tonsils, spleen, and our thymus. So our lymph is the clear or yellowish fluid derived from interstitial fluid found in the lymphatic vessels. The main role of lymph is to carry fluid in one direction from tissues to the circulatory system. Fluid moves from blood capillaries into tissue spaces. Lymphatic capillaries are tiny closed-ended vessels consisting of simple squamous epithelium, more permeable than blood capillaries because they lack a basement membrane and fluids move easily into them. So our lymphatic capillaries are actually more inclined to accept various substances into them. Overlapping squamous cells of the lymphatic capillary walls act as valves that prevent the backflow of fluid, and they join together to form lymphatic vessels. So this is the anatomical breakdown of our fluid system. So arteries carry blood away from the heart. It will eventually subdivide into our arteriole and our blood capillaries. Eventually, the fluid will enter through tissue cells, and tissue cells will eventually drain out to our lymphatic system. Our lymphatic system is designed to prevent backflow. It actually has a series of valves to prevent backflow. So, lymphatic vessels resemble small veins. Small lymphatic vessels have a beaded appearance because they only have one-way valves that are similar to the valves of veins. When compressed, the valves prevent backward movement of the lymph. Consequently, compression of the lymphatic vessels cause lymph to move forward through them. There are three factors that cause compression of lymphatic vessels: contraction of the surrounding skeletal muscle during activity, periodic contraction of smooth muscle in the lymphatic vessel wall, and pressure changes in the thorax during breathing. So these are your lymphatic veins. You have two major ducts that drain lymph from various parts of the body. So your right lymphatic duct drains the lymph from the right arm and the right side of the head and the thorax. It empties through the subclavian vein. Your left thoracic duct receives lymph from the rest of the body. Then it empties to the left subclavian vein. So this is the separation of your right and left body. Please take note that our left lymphatic duct has a greater role or a greater area in which lymph will drain out from. So some anatomical parts, this is your cisterna chyli, and this is your thoracic duct. You can notice that the cisterna chyli is a little bit bigger than the duct itself. Other lymphatic organs include the tonsils, the lymph nodes, the spleen, and the thymus. Within each lymphatic organ, lymphatic tissues consisting of many lymphocytes and other cells such as macrophages can be found. Lymphocytes originate from the red bone marrow and are carried by the blood to lymphatic organs. These lymphocytes divide and increase in number when the body is exposed to pathogens. The increased number of lymphocytes is part of the immune response that causes the destruction of pathogens. So let's talk first about the tonsils. So the tonsils are actually made of multiple parts. They form a protective ring of lymphatic tissues around the opening between the nasal and oral cavities and the pharynx. That is why when you're experiencing a cold, one of the first symptoms you will experience is a pain in swallowing. It's because your tonsils tend to inflame because phagocytic cells are fighting in that organ. They protect against pathogens and other potentially harmful material entering from the nose and mouth. Three groups are the palatine, the pharyngeal, and the lingual tonsils. Your palatine tonsils are located on each side of the posterior opening of the oral cavity. These are the ones we refer to as the tonsils. Sometimes they become chronically infected and must be removed. So the palatine is the one found on the sides of your mouth. So when you open your mouth and a tongue depressor is used, you can see the palatine tonsils on the side of your pharynx. Your pharyngeal tonsils, on the other hand, are located near the internal opening of the nasal cavity. When enlarged, it is called the adenoid or the adenoids. An enlarged pharyngeal tonsil can interfere with normal breathing, sometimes can be chronically infected and must be removed. And the lingual tonsil is found on the posterior surface of the tongue. Becomes infected less often than the other tonsils and it is much more difficult to remove. So these are the different parts of your tonsils. Another figure describing where your tonsils can be found. Next, you have your lymph nodes. These are rounded structures varying from the size of a small seed to that of a shelled almond. Located along various lymphatic vessels, their main role is to filter lymph. Major lymph nodes are found in your groin, in your armpit, and in your cervical. They are named your inguinal nodes, axillary nodes, and cervical nodes, respectively. Your inguinal nodes filter lymph from lower extremities, including your external genital organs. Your axillary nodes filter lymph from the hand, arm, and breast. Your cervical nodes filter lymph from the head and the neck. So these are the nodes when viewed. So it is not actually one big node. It is a series of smaller nodes. This is your axillary near your armpit. That is why sometimes you will feel pain in that region even though there is no trauma. Your mediastinal nodes is found in the center of your chest. It primarily filters around your heart. You have your inguinal and your iliac nodes. And so these are actually the whole SEM view of your nodes. You can see the reticular fibers and the lymphocytes that guard these nodes. So this lymph node structure consists of the following. You have your afferent lymph vessels, which is a vessel that conducts lymph into a node, meaning papasok. You also have your efferent lymph vessel, which conducts lymph out of the node, so palabas. You also have your lymphatic nodules. These are aggregations or masses of lymphatic tissues. They contain germinal centers. These germinal centers are composed of rapidly dividing lymphocytes, sites of lymphocyte production. So this is the general structure of your lymph node. So you can see that the afferent conducts lymph in, and the efferent conducts lymph out. Your cortex is within the node. Within the node, you have your lymphatic nodule and your germinal centers. You also have your Lymphatic sinuses, which are the spaces through which lymph circulates, they surround each lymph node. The capsule functions as the outer boundary and support structure for each lymph node. And you have your trabeculae, which is extensions of the capsule which subdivide a lymph node into compartments containing lymphatic tissues and lymphatic sinuses. So this is the anatomical view of your lymph node. Next, you have your spleen. So your spleen is roughly the size of a clenched fist, located in the left superior corner of your abdominal cavity. It filters blood instead of lymph, and the most important function is to destroy worn out red blood cells and return some of their breakdown products to the liver. So your spleen recycles your red blood cells. It is the graveyard of your red blood cells and also acts as a blood reservoir. So your spleen has an outer capsule of dense connective tissue and a small amount of smooth muscle. Tuberculae from the capsule divide the spleen into small interconnected compartments containing two specialized types of lymphatic tissues. You have your white pulp and your red pulp. So your white pulp is lymphatic tissue surrounding the arteries within the spleen, while your red pulp, associated with the veins, consists of a fibrous network filled with macrophages and red blood cells and enlarged capillaries that connect to the veins. So this is your spleen. You can find it just above your kidneys. This is the anatomical view of your spleen. It is very vasculated and together with the red pulp and your white pulp. Next, you have your thymus. Your thymus is a bilobed gland, roughly triangular in shape. It is located in the superior mediastinum, the portion dividing the thoracic cavity into left and right parts. It generally stops growing at age 1, meaning it is uh, relatively small in our infants, and it starts to decrease in size at age 60. The size for the maturation of a class of lymphocytes called your T cells. Thymus tissue is mostly replaced with adipose tissue as we age. So this is your thymus. In infants, it is actually much more prominent than compared to an adult's thymus gland. Okay, so this is what it looks like anatomically. And this figure describes the flow of blood and lymph towards the different parts of our lymphatic system. So next we have is immunity. So what is immunity? Immunity is the ability to resist damage from pathogens such as microorganisms, harmful chemicals such as toxins released by microorganisms, and internal threats such as cancer cells. We have two types of immunity, which is innate and adaptive. So, innate adaptive is a general type of immunity in which it destroys all types of substances that is foreign to it. Also known as your non-specific resistance, it is present at birth. It is accomplished by physical barriers, chemical mediators, white blood cells, and the inflammatory response. So physical barriers is your skin. These prevent pathogens and chemicals from entering the body in two ways. First is your general defense, which is your skin and mucous membranes. These are barriers to entry for your pathogen. Next is your tears, saliva, and urine. These wash the substances from the body surfaces. Pathogens cannot cause a disease if they cannot enter the body. Next, you have your chemical mediators. Your chemical mediators are chemicals on the surface of cells that destroy the pathogens to prevent their entry into the cells. We have several examples. First is your lysozyme that is found in tears and saliva. This kills certain bacteria. Next is your mucus. Mucus is found in your mucous membranes, like in your nasal cavity, and prevents the entry of some pathogens by trapping them in the viscous fluid. And next, you have your histamine, which is an inflammatory cytokine that causes vasodilation. If there is vasodilation, there will be a presence of more white blood cells. Next, you have your complements. So, complements are proteins that promote inflammation and phagocytosis and can directly rupture bacterial cells once they are activated. Interferons, on the other hand, are proteins that protect the body against viral infections by stimulating the neighboring cells to produce antiviral proteins, thus preventing the replication of the virus. So you also your white blood cells. These are produced in the red bone marrow and the lymphatic tissue and released into the blood. Chemicals released from the pathogens or damaged tissues attract these white blood cells and they leave the blood and enter the affected tissues. Important chemicals known to attract white blood cells include the complement, your leukotrienes, your kinins, and your histamines. The movement of white blood cells towards these chemicals are called chemotaxis. Next, you have your phagocytic cells. These are cells that can ingest and destroy microorganisms or their parts inside their body. The most important phagocytes are your neutrophils and macrophages, although there are other white blood cells that have limited phagocytic ability. So your neutrophils, these are usually the first cells to enter the infected tissues from the blood in large numbers. They often die after phagocytizing a single microorganism. They are found in large numbers and are usually the first to go. Next, you have your macrophages. Macrophages are monocytes that leave the blood, enter the tissues, and enlarge about fivefold. Sometimes given specific names such as dust cells in your lungs, Kupffer cells in the liver, and microglia in your CNS. Usually they appear in affected tissues after neutrophils do and are responsible for most of the phagocytic activity in the later stages of an infection. So their role includes cleaning up the dead neutrophils and other cellular debris. Also found in uninfected tissues and may phagocytize the microbes even before they can replicate or cause damage. Other cells of inflammation, we have your basophils, mast cells, and eosinophils. So basophils are derived from your red bone marrow. These are motile white blood cells that can leave the blood and enter infected tissues. They can release histamine. Mast cells are derived from red bone marrow. They are found under the skin, GI tract, and urogenital tract. The most important role of your mast cells, or most relevant, is they can be found in the lungs. They can release leukotrienes together with histamine, and they can cause your lungs to inflame, or particularly your bronchioles to inflame, and this can precipitate asthma. Eosinophils also participate in inflammation associated with allergies and asthma. Next, you have your natural killer cells. This is a type of lymphocyte produced in red bone marrow. They account for up to 15% of lymphocytes, and they recognize classes of cells such as tumor cells or virus infected cells rather than any specific tumor cell or any specific cell by a specific virus. They use a variety of methods to kill their target cells, including releasing chemicals that cause the cell membranes to lyse. Next, you have your inflammatory response. So, your inflammatory response involves a release of chemicals and cells due to injury, stimulates the release of other chemical mediators, and the effects of these chemical mediators is number one, vasodilation. Number two, phagocytes leave the blood and enter the tissue. Increased vascular permeability allows fibrinogen and a complement to enter the tissue from the blood. The amount of chemical mediators in the phagocytes increase until the cause of the inflammation is destroyed. Then the tissue undergoes repair. We have two types. We have local, in which the inflammation is confined to a specific area of the body. It primarily produces redness, heat, swelling, pain, and loss of function. Systemic inflammation is an inflammatory response generally distributed throughout the body. Symptoms include an increase in neutrophil numbers, fever, and shock. So sometimes, when you encounter a very strong allergic response, it causes systemic inflammation, and it one of those is anaphylaxis or anaphylactic shock, in which your body will actually decrease your blood pumping capacity. So this is the diagram on how inflammation occurs together in how your body fights the invading organism. Next, you have your adaptive immunity. Your adaptive immunity supplements innate immunity. It is generally absent at birth and also known as your specific immunity or acquired immunity. It exhibits specificity and memory, and it can be divided into antibody mediated and cell mediated immunity. When we say specific, it is the ability of the adaptive immunity to recognize a particular substance, meaning it can recognize specific microorganisms. When we say memory, it is the ability of your adaptive immunity to remember previous encounters of that microorganism, and it can produce an immediate response. So your antibody-mediated immunity involves a group of lymphocytes called your B cells and proteins called antibodies, which are found in the plasma. Antibodies are produced by plasma cells, which are derived from the B cells upon activation. Cell-mediated immunity involves the actions of the second type of lymphocyte, also called your T cells. So some terms related to adaptive immunity. So when we say antigen, this is a substance that stimulates adaptive immune responses. This can be anything from bacteria to pollen to drugs. Self-antigens are molecules produced by the body that stimulate an immune system response, beneficial or non-beneficial. And when we say antibody, these are proteins produced by the body in response to antigenic stimulation. Sometimes called your gamma globulins because they are mostly found in the gamma globulin part of the plasma, or your immunoglobulin because they are globulin proteins involved with immunity. So, origin and development of the lymphocytes. So your lymphocytes originate from your stem cells. So stem cells give rise to all blood cells in the red bone marrow. They give rise to pre-T cells, which migrate through the blood up to the thymus, where they divide and are processed into T cells. They also produce pre-B cells, which are processed in the red bone marrow into B cells. Once they are matured, B cells and T cells move to lymphatic tissue from their processing sites, and they continually to circulate from one lymphatic tissue to another. Okay, so I think there's so here's a good mnemonic to remember where they come from. So your lymphocytes, these are specialized cells that are responsible for immune responses. The T lymphocytes, or your T cells, differentiate and mature in your thymus gland, hence the letter T. Thymus, T cell. B cells mature in the red bone, hence they are called B cells. They are responsible for they are also called they are also responsible for humoral immunity. So this is the lymphocytes. So lymphocytes have antigen receptors on their surfaces called B cell receptors on B cells and T cell receptors on T cells. Each receptor only binds with a specific antigen. And when antigens combine with the antigen receptors, the lymphocytes can be activated and adaptive immune response begins. So we have your major histocompatibility complex molecules, or your MHC. These are glycoproteins containing binding sites for antigens, and it is only specific for certain antigens. Your MHC class 1 molecules are found on the membranes of most nucleated cells, meaning most of your cells in the human body can possess MHC class 1, while MHC class 2 are found on the membranes of antigen-presenting cells, B lymphocytes, and other defense cells. Their main function is to serve the antigen that they hold and present it to your helper T cell or the other immune cells. So your MHC actually combines with the antigen. When it is processed, it will be brought out into the surface of the cell, wherein it can now be presented to other cells. Next, you have your cytokines. Cytokines are proteins or peptides secreted by one cell as a regulator of neighboring cells. So an example is interleukin 1, a cytokine that is released by macrophages that can stimulate helper T cells to secrete interleukin 2 and to produce interleukin 2 receptors. So after the antigen is processed and presented to a helper T cell by a macrophage, the helper T cell responds by producing interleukin 2 and interleukin 2 receptors. Once the helper T cell receives interleukin 2, it will now start to divide, and it will cause more helper T cells to form. Helper T cells are necessary for the activation of most B cells or T cells. So this is the general process on how it is processed. If you are interested on how this process works, please read your book. Also, there is a separate lecture for a more in-depth discussion on immunity. And this is how the B cell is activated. So we have your antibody-mediated immunity. Your B cells, once activated, become plasma cells, and once your plasma cells are formed, they can produce antibodies. The antibodies structure, these are Y-shaped molecules consisting of 4 polypeptide chains, 2 identical heavy chains, and 2 identical light chains. We have 2 regions, your variable and your constant region. So your variable region is the V part of your Y shape. They are the end of each arm of the antibody and part of the antibody that combines with the antigen. Can only join with a particular antigen, similar to the lock and key model of enzymes. For the constant region, it is called the stem of the Y. It can activate the complement, or it can attach itself to the antibody to cells, or such as macrophages, basophils, and mast cells. So this is the different parts of your antibody. So this part here is your variable part, and this is your constant region. Your heavy chain is found inside, and your light chain is found outside. Next, you have your antigen binding site, which is the part of the antibody where the antigen binds. Valence is the number of antigen binding sites on the antibody. So we have different types of antibodies, but these are the most common. You have your IgG, which is composing of 80 to 85% of your immunoglobulins. The only antibody capable of crossing the placenta. Produced in high amounts during secondary response. Next, you have your antibody A or IgA. It is a dimer, meaning you have 2 parts. One antibody here, second antibody here. Composing 15% of the immunoglobulins. They are predominantly found in body secretions. Protects mucous membranes and internal cavities from infection. Next, you have your IgM. It is a pentamer, meaning you have 5 units of antibodies composed of 5 to 10% of your immunoglobulins. Predominant antibody in the primary response and primarily destroys gram-negative bacteria. Next, you have your IgD. It is another monomer and functions as antigen binding receptor on B cells. found in blood and on lymphocytes. And last, you have your IgE, which is another monomer, causes allergies, drug sensitivity, anaphylaxis, hypersensitivity reactions, combats parasitic diseases. So these are the different antibodies again, and their short description on what they do. Roles of your antibodies: first, they can inactivate the antigen, they can bind antigen together, and they can also activate the complement cascade. The complement cascade stimulates inflammation, attracts white cells, and causes lysis of the bacteria. Your antibodies can also initiate the release of inflammatory chemicals from the mast cells and basophils, and they can also facilitate phagocytosis. Here is the different roles of your antibodies. So your antibody production results from the first exposure of a B cell. So once a B cell is activated by a helper T cell, it undergoes several divisions to form plasma cells and memory B cells. Plasma cells produce antibodies and normally takes 3 to 14 days to produce enough antibodies to be effective against the antigen. Antibody M is the predominant antibody. Your secondary response stems from their memory B cells. So if the body is exposed to the same antigen, memory B cells quickly divide to form plasma cells, which rapidly produces antibodies. So this produces better protection than the primary response because the time it takes to start producing antibodies is less, and more plasma cells and antibodies are produced. Also includes the formation of new memory cells, which provide protection against any additional exposures to a specific antigen. So this is the difference between your primary and secondary response. Next, you have your cell-mediated immunity. So it is a function of cytotoxic T cells and is most effective against microorganisms that live inside body cells. Also involved with some allergic reactions, the control of tumors, and graft rejection. This also fights viral infection by destroying virally infected cells. So the main key player here is your cytotoxic T cells. After being activated by an antigen on the surface of a target cell, this undergoes a series of division to produce additional cytotoxic T cells and memory T cells. The cytotoxic T cells are responsible for cell-mediated immune response, and memory T cells provide a secondary response and long-lasting immunity in the same fashion as memory B cells. So this is the diagram on how it works. We have 4 subsets of T cells. First is your helper T cells, which these help B cells to produce antibodies. You also have your T suppressor cells that suppresses B cells not to produce antibodies. You have your T cytotoxic T cells, or T cytotoxic cells, which lyse and destroy foreign cells and cancer cells, and virus-infected cells. These reject grafts and transplants. And you have your T delayed type hypersensitivity, involved in some delayed allergic reactions. Okay, so this is the general way on how the whole process is produced. Next, we have the different types of adaptive immunity. So we have first the naturally acquired immunity. So our naturally acquired immunity is subdivided to active and passive. For our active, there is natural entry of antigen and the body reacts. The body is exposed to a disease-causing microbe or your antigen. And an example is an actual exposure to Mycobacterium tuberculosis. When we say natural, meaning you are not intentionally administered the antigen. When we say passive, there is no entry of the antigen and the antibodies are transferred from the mother to her child. particularly through placental transfer in the first few months of life and in breast milk. For your artificially acquired immunity, this is when we administer our vaccines. So artificially acquired active is the host is injected with the antigen, then the body is stimulated to produce antibodies. The best example is the administration of a vaccine. The vaccine contains the attenuated or weakened causative agent, meaning it does not produce a very strong immune response. However, it will still cause the body to produce antibodies, particularly memory cells. So you have your BCG, DPT, and MMR. BCG is for your tuberculosis, DPT is for diphtheria, MMR is measles, mumps, and rubella. So that is artificially acquired active. So when you oppose it to passive, you are now instead given antibodies in the form of immune serum globulins. Best example is immunization, and usually administered after accidental exposure to antigens like your anti-tetanus and anti-rabies. So artificially acquired passive is when you are administered antibodies instead of the antigen. Most of the time it is used because if you administer the antigen, it will be too late to fight what the previous infection caused you to seek antibodies. So example, ganito, para madaling explain. Pag nakagat ka ng aso, ang ibibigay sa iyo ay antibodies because you are already bitten. You are already injected with the antigens, and if you're going to wait for your body to produce an immune response, it might be too late. So that is why you are given antibodies to directly fight the infection. However, if you are handling animals, like pharmacists, you are given an vaccine, meaning it will cause your body to produce antibodies. In any case na makagat ka, may antibodies ka na present. You do not need the antibodies from the immunization anymore. And finally, we have the effects of aging on the lymphatic system. So aging has little effect on the lymphatic system's ability to remove fluid from the tissue, absorb lipids, and remove defective blood cells. Decreased helper T cell proliferation results in decreased antibody-mediated and cell-mediated immune responses. And primary and secondary antibody responses decrease with age. So as you grow old, your immune system weakens. And the ability to resist intracellular pathogens also decreases with age. So that is all for this lecture. What I want you to do is to watch the bonus lecture, which delves deeper into immunity, particularly the very specifics of how your immune system works. So that will be all. Thank you and have a nice day.